go in and assist. You've got a milk mustache. Happy grazing. So the first thing that I'm going to do 24 hours postpartum for my does is clean them up a little bit. You don't have to be super particular about this, but you don't want to leave any like big chunks of anything on her back end, but a little bit of light staining is normal and she's going to work that off on her own. I am going to focus a little bit on her teat area because I am going to milk her and I need that to be clean. So all I have in my jar down here is warm soapy water and a nice microfiber cloth, and I'm just gently going to clean her off. Shvenny here is a third freshener. She's not the best goat as far as milk stand manners goes, but she's not too bad. So I don't know how easily it's gonna come up on camera, but she is 24 hours postpartum and the kids seem to be favoring one side. So one side is a lot more full than the other side. And this is one of the reasons that I like to get my hands on my does as quickly as possible after birth so that I can manage things like this and keep her udder even. A lot of you who have been with the channel for a while know that I usually will hobble my goats, which is basically tying their feet to the milk stand so that they can't kick. I can't hobble Shvenny, it freaks her out, and I would really rather deal with a little bit of hunching and kicking than have her really be stressed out and flailing. So I do have one hand on the milk bucket and one hand on the side of her udder that is extra full right now. So even though she is only 24 hours postpartum, it does look like her milk has changed over from colostrum into milk. I had wondered if this full side was going to be more colostrum, but it's not. It's actually milk. I'm actually better at milking with my left hand, even though I'm right-handed. So I'm going to do a switcheroo at myself. And don't be worried about milking your doe out as much as you can get at this point. They are going to hold back milk for their babies, and you're going to be able to feel it in the udder. The bottom half of the udder this way is going to be really soft where she lets the milk out for you, and the top half she's going to hold that milk real hard because she doesn't want you to have it all, and I mean she's a good mama. So I like to get out as much as I can. It helps keep on top of her milk supply, and she's got no problem feeding her babies. I only do this once a day. If your goat is a little bit skittish on the milk stand, it's a really good idea to dump out the milk pail often, just in case they happen to kick it over. Hopefully they wouldn't have kicked over everything. While I've got my hands on her udder, I can assess if I feel any extra heat coming off of her udder. Her udder should not feel hot at all. I mean, it's warm because the goat themselves inside they're 103 degrees, give or take. But you shouldn't feel an extra hot udder. There shouldn't be any lumps in the udder aside from, you know, mammary tissue that you're gonna feel in there. It shouldn't be any abnormal lumps. And you shouldn't be seeing like really thick, stringy milk. If you see some colostrum in the very, very beginning, that is really thick, but it's pretty consistent. It's very, I guess homogeneous is the word that I'm looking for, but it's not going to be streaky. Just giving her udder a little bit of a massage. Sometimes it helps bring extra milk down, but she's holding it in real good for her boys. Overall, your doe should be back to normal really soon after giving birth. She shouldn't be really walking funny. She shouldn't be limping. You shouldn't really know that anything happened besides the evidence that's on her back end, the blood and a little bit of swollen area around her vulva. It shouldn't be anything excessive, but her temperament should be just like you remembered before she gave birth. She may be a little bit more protective of her kids. That's normal and fine, but she shouldn't be extra sleepy, and she should be eating normally as well. Another thing to watch out for, especially in heavily lactating does, is you want to make sure that their muscles seem to be working well. If your doe is having a hard time getting up, or you're seeing she's kind of got the shakes in her back end or really anywhere, you want to consider that she maybe has hypocalcemia, which is a low calcium level. Sometimes when they come into milk real hard, the body saps that calcium out of their blood, and calcium is really important for muscle function. So anything either right close to birth or right after birth that affects their musculature, think about them being low on calcium. You can get CalMag supplements and give them to the goats. I have a calcium supplement that I use. It's made for dairy cows. It's a really important thing to have in the kidding kit just in case. So if you watched Shveni's birth, you saw that I did have to go in and assist her birth a little bit. I am not going to give her an antibiotic just automatically. The body is very, very good at healing. She has an immune system that does work, but I am going to keep an eye on her. I don't like to flippantly give antibiotics. I like to give them only when they're needed, and right now I'm not seeing any evidence that it is needed. So the does are going to have a little bit of discharge, a little bit of blood. They should expel their placenta within the first 12 hours, but up to the first 24 hours is fine. If she doesn't expel it at that point, she would probably need some antibiotics, and she definitely needs some oxytocin to help expel that placenta. You're going to want to talk to your vet about getting those prescriptions. Lots of does will eat their placenta after birth. She did that. She actually didn't do that the last 2 years, but this year she ate her after birth, and that's going to help her replenish some lost nutrients and lost energy that comes from having babies. Are you ready to go? We can talk about you out there. Ooh, watch those horns. Goodness. So as far as the discharge go, it should be, you know, very minimal. Goats don't bleed as much as humans do after birth. And the blood that you'll see is usually, it's kind of clearish. It's not as bright red and thick as right after they give birth. It's definitely like a thinner, more plasma containing type of discharge. It's not going to be pussy. So if you see anything like that looks like pus coming out of her back end, that would concern me. Any weird smells coming out of the back end, that would concern me. Usually something like that is going to be accompanied by a goat that is really not acting normally, really acting lethargic. And as far as uterine infections go, to my knowledge, the best antibiotic for those is oxytetracycline. So that's a good thing to have on hand. See, you got some milk, didn't you? You've got a milk mustache. So if you do happen to deliver some kids that maybe weren't using their back legs very well and you supplemented them with selenium, don't forget that if the kids were low on selenium, that means that the doe is also low on selenium and she's gonna need a dosage as well. We used to use that selenium and vitamin E paste that you can find all the time at the Tractor Supply or other farm store. We don't use that anymore. We actually get a Bo-C injectable from our vet, and that works very well. Some does will return to the herd perfectly well. A lot of does will just be a little bit more cautious, which is fine. Both instances are fine as long as mom is taking care of her babies. But I've noticed that Shveni, ever since I've let her out of the kidding stall, she doesn't go out into the pasture and graze with the rest of the goats. We have a pretty large pasture here, and she doesn't, I guess she knows that her babies can't make it that far, and she stays back and hangs with them. That is completely fine. Eventually, when she's determined that her babies are strong enough and can handle the journey, she's gonna bring them out there with her. You going out? Yeah, there they go. They're all out there. Happy grazing. Shveni was very fortunate to not have any tearing of her back end. Sometimes that can happen with large kids or kids that are folded in a weird position. But if your doe did experience a little bit of tearing, stitches usually aren't necessary. I've had some does tear a little bit in the past. Just keep a close eye on it in the very least. You can also use a topical wound spray. I like to use the ones that aren't blue tinted dye, like Blue Coat. Blue Coat is fine, but the blue just gets all over everything, and it makes it hard to tell the color of the discharge that's coming out of the doe. So using a clearish wound spray is my recommendation. Something like witch hazel could also be really helpful. I know that was helpful for me after I gave birth. And sometimes when the does have had a rough delivery, it is kind to give them some kind of like Banamine or pain reliever. Shveni is not acting like she really needs it, so I have not given her anything like that. But again, we didn't have to really manipulate the kids from the inside at all. Aspirin is also a really good pain reliever to have on hand for the does. Sometimes after does give birth, they will have a loosening of their stools. This doesn't happen all the time. From what I've been told, that can be normal. Sometimes the contractions of the uterus can cause the other organs that are close to the uterus to get a little bit contracty as well, and sometimes their poo pellets can move through their system a little bit faster than they normally would, just from like the different hormones and things, and from those muscle contractions happening inside of the doe. Keep an eye on her. It really should not be anything runny, but something where the pellets are clumping a little bit closer together could be normal, but it could also be worms or maybe even coccidia coming up. So just keep an eye on that, but understand that it could also just be nothing. And so it's probably not something that you necessarily need to jump on the dewormers for. Fly spray, or some way to keep flies off of the doe's back end, can be super helpful at this time. The flies are going to be really drawn to her backside the next couple weeks, and they can breed a whole bunch of disease, and you really don't want that. After the doe gives birth too, it's really important that her nutrition be supplemented, be increased. She is still growing kids even though they are on the outside. There's a feeding rate on the label of my feed bag, and I think it was, I'll have to look, I'll have to put it on the screen here, but there's so many pounds of feed that are given for so many pounds of milk. So you may want to weigh your milk, but understand that the amount of milk that you're getting does not equate to the amount of milk that she's putting out, because she's going to hold on to it. So I know from past experience that Shveni is good for about a half gallon of milk just for me once a day. And so she can make about a gallon of milk for me and her kids. And so I need to account for that in the amount of feed that I'm giving her. Hi, Mars. Definitely keep watch of your doe's body condition. Right now, Shveni's body condition, there's a numerical scale for it. It's about a 3, which is really good. She can tend to lose condition really quickly when she's in milk because she puts so much of her energy into the milk pail, so the feed ration may have to be adjusted accordingly. Look at this dog. Look at Marzi. What are he doing? What is he doing? So I've got a lot of really awesome goat people that are following my channel, and I'm going to ask them to contribute in the comments anything else that you think other goat owners should contribute to their postpartum doe care kit for their farm. Gotta get up off the ground. They're starting to run me over. So comment down below if there's anything else you would like to add. Comment down below if you have any questions. Somebody, if not me, is going to be able to help you.